Dental Clinical Photography at the University of Texas School of Dentistry at Houston. Check out the proper mirror cassette and clinical camera from the dispensary. Requires requisition form. Picture A is an example of a treatment planning mirror cassette. Picture B is an example of an aesthetic treatment mirror cassette. In this instructional video, a Nikon D7200 digital camera is used. Turn the camera on, red circle, using the switch located around the shutter button, green arrow. Before taking clinical pictures, the camera settings must match the objectives of photography. The mode dial, red arrow in picture A, is used to change camera settings. For portrait photos, the mode dial is set to U1, blue arrow. For close-up views, the mode dial is set to U2, green arrow. To change settings, press and hold the center mode dial release button, picture B, and turn the mode dial until your choice lines up with the white line, red circle. For clinical photography, proper light illumination is necessary. To control the lighting, internal or external flash is utilized. In this video, external ring flashes are demonstrated. In camera A, the ring flash is connected via a cord to the flash control. In this case, the internal flash is not needed. In camera B, the ring flash syncs remotely with the internal flash. For attached flash control type, assemble flash control by sliding it onto designated slot on the camera body, red arrow. The black ring tightens to the left. Press the on-off button until the indicator light is green, red circle. For remote flash control type, first press the pop-up flash button, red circle, to raise the built-in flash as seen in this picture. This will sync the camera to the ring flash. Next, turn on the ring flash using the power switch, red circle. When the indicator light is green, the flash is charged and ready to fire. If the indicator light does not turn on, replace batteries. 2 AAA batteries are recommended. The battery door location is shown on this picture. Once the flash and the camera are on, ensure that the f-stop number, red arrow, corresponds with the mode dial selection. F8 for U1, F32 for U2. The camera can either be used in AF and MA autofocus mode, green circles, or M, manual focus mode, red circles. It is recommended for the camera to be set to M for most shots, unless in portrait mode, U1, for which the setting is changed to AF and MA. Set the image magnification by turning the focusing grip, blue arrow. Once the magnification is set, green arrow with orange numbers, look through the camera viewfinder, orange arrow, and move towards and away from the subject until sharp focus is seen. Then press the shutter button to shoot. Note, a 1:3 magnification ratio, green rectangle, is a good starting point for anterior, buccal, and occlusal views. Choosing a smaller number, 1:2 or 1:1, gives a smaller field in the photo and can be used for fewer teeth. Clinical photography protocol. Ask the patient to smile big as you capture the portrait smile image. Camera settings, AF, MA, U1, lens magnification 1:10. Portrait smile. Ask the patient to say Emma as you capture the full portrait repose image, same camera settings. Portrait repose. Ask the patient to look straight ahead, relax lips together as you capture the portrait profile image, same camera settings. Portrait profile. Change the camera settings to MM, U2, lens magnification 1:3. Ask the patient to smile big and say E as you capture the close-up front smile image. Close-up front smile. Ask the patient to look straight ahead and say "ee" as you capture the lateral right smile image. Walk to the left side of the patient and repeat for the left image. Same camera settings. Lateral smiles, right and left. Ask the patient to gently place the plastic cheek retractors in their mouth and to bite down. Capture the front closed retracted image, same camera settings. Front closed retracted. Ask the patient to turn their head to the right and gently retract the cheek to the left. Capture the left closed retracted image, same camera settings. Left closed retracted. Ask the patient to turn their head to the left and retract the cheek to the right. Capture the right closed retracted image, same camera settings. Right closed retracted. Ask the patient to slightly open their mouth and push up or down the plastic cheek retractor if needed to center the teeth. Capture the front open retracted image, same camera settings. Front opened retracted. Place the occlusal adult photo mirror in water bath 110 to 115 Fahrenheit to reduce fogging. Gently pat dry the mirror. With the help of an assistant, insert the mirror in the mouth to capture the reflection of the entire maxillary arch. Apply constant air to reduce fogging of the mirror. Capture the maxillary occlusal image, same camera settings. Maxillary occlusal. Place the mirror against the maxillary occlusal arch and repeat the process for the mandibular arch view. Capture the mandibular occlusal image, same camera settings. Mandibular occlusal. This concludes the required images needed for general treatment planning. 3 more images are needed when documenting aesthetic cases. For the next few images, a dental contraster is used to capture enamel effects and incisal embrasure forms of anterior teeth. Assist the patient to position the contraster lingual to maxillary anterior teeth. Capture the maxillary anterior with contrast image, camera settings mm, U2, lens magnification 1 to 2. Maxillary anterior with contrast. Ask the patient to move their head to the right to capture the left maxillary anterior lateral with contrast image. Move patient's head to the left and repeat for the right image, same camera settings. Maxillary anterior lateral with contrast, right and left. To allow for rest, ask the patient to remove the plastic cheek retractor as needed. To transfer images to patient's electronic health record, EHR Open Axiom, select X-ray to open My Packs. Select the proper template. This will usually be photography 12 or photography 24 depending on number of captured images. Attach the camera's USB cable to the computer and camera. Turn on the camera. A message will appear on the computer screen regarding the transfer of images to computer and their permanent deletion from the camera. Select Yes to transfer. Once images are transferred, select Save As and name the file. For example, aesthetic treatment planning would be an appropriate name for this file. When finished, turn off the camera and flash. Disconnect USB cable from the computer and the camera. Return camera and mirror cassettes to dispensary.